So hi guys, today I'd like to talk about what to expect as a nurse when you're coming to work as a nurse in New Zealand or Australia. And I'm just going to be touching on a few pointers regarding this. But before I start my video, could you please like my video and subscribe to the channel? That would be very, very good. Thank you. Firstly, uniforms. When you're starting at your new position, you'll probably get 2 blouses, 2 pairs of pants, summer and winter, depending on your where you are working, and also a cardigan. This isn't always free. Sometimes you will have to, they'll tell you, sign a little piece of paper and they'll say, oh, $100, but you don't have to pay that all up front. It'll be taken off your wages for the next 4 months or so, 3 months. So you hardly see that you've actually paid for it. Or it could be that you get some scrubs, and when you leave the facility, you will be returning the scrubs. Sometimes facilities do actually give you uniforms, like maybe just 2 shirts and you then and a cardigan, and you then have to provide your own navy pants, and they will like you to wear possibly black sneakers or black leather shoes. When you're working for agency, you generally get 2 shirts for free, and you will wear your, let's say, black pants or navy pants or whatever their uniform is. And every so often, like after you've worked a certain amount of hours, you get another shirt as well. So what to expect with regarding shifts. So a shift is not 12 hours generally. Your shifts will be about 8 hours long, and sometimes 10 hours if you're on a night shift. The shifts, they can start anywhere from sometimes 6:30 in the morning, 7 o'clock, 7:30, even up to 8 o'clock. And then, so it's quite a user-friendly hours, and then sometimes ending at 2:30, 3 o'clock or so. The other thing to remember is that you will get paid more when you're working afternoon shifts or night shifts. Your rate increases. Staffing is another point. So with regards to the hospitals, you will have 5 patients to 1 nurse. On night shift, that will be 8 patients to 1 nurse. And then in residential homes, it's generally, there's 2 carers per 10 residents, an EN between 20 residents, and then an RN oversees the whole facility. And during the day, up until about 4 o'clock, there'll be a clinical nurse manager on duty as well as the RN, and then often there's 2 ENs taking care of the 40 residents, so 20 per EN. At night, normally in the residential aged care, you will have an RN on at night and a carer, depending on how big the facility is, maybe a few carers. But I'm just giving you an example for where I was working. It's 40 residents and an RN at night and 1 carer. And up until recently, you didn't have an RN actually in the facility. It was indirect. So the RN was on call, and the EN was the nurse on duty at night, and any queries she would call the RN. So it would have just been an EN and a carer at night. But the government legislation has recently changed, and now an RN has to be available on every single shift, be present in the facility. Now documentation. So documentation is generally done online, not paper-based. Although saying that, the paper records are still available in the facility, in the office, in the nurse's station, and they have to be updated regularly. All the medication charts and that have to be updated, printed from the online site, and updated, so that when we have doctor's rounds, the doctor can actually page through the patient's file and see at a glance what needs to be prescribed or what medications the patient is on. But there's various different online documentation available in facilities. You get Best Med, Autumn Care, and eCase. And also LeeCare. I use LeeCare in New Zealand. LeeCare to me is a lot like eCase, and I find eCase very user-friendly. That's the most user-friendly that I found, and I work in quite a few different facilities, being an agency nurse. With eCase, it's just very user-friendly. Easy to find the various things, and you would do your progress notes on there, on that website, on the online site, You would look up the patient's history, you would see all their medications, it's easy to find their PRNs, and when last they received the medication. I found ECase very good. So pay, you can work as a casual. Mostly you start off as casual, and that's a higher rate. So you can join an agency and then work in various different facilities. That's really the easiest option when you're starting anywhere, and you get a higher rate. And also you can click on, once you've done your shift, you click on, and let's say you need the money straight away. You can do a shift with an agency, and you can click on quick pay, which means that you get that money the next day. An average 8-hour shift, let's say in a rest home with agency, will be anything from $270 up to maybe $330 cash in hand. That's basically what I'm getting. That's for a level 3 EN. But it just depends how many years you've worked and that sort of thing. You can get a higher rate of pay, let's say, if you actually get letters of reference from the previous places you've worked at, explaining what you did, what your role was, and how many hours you've worked in that facility. So that's also how you increase your rate of pay. And if you prove that you give this to the agency, they'll notch you up a few levels as well in your pay rate. The other thing to remember is that when you're working agency, a lot of the time your shifts can be cancelled at the drop of a hat, sometimes 2 hours before, because a lot of facilities might not want to pay the agency rate. They might find their own staff to cover before your shift. So just keep that in mind, that sometimes shifts are sometimes cancelled 2 hours before, and that can be quite stressful. You could also work rural and remote through an agency. This is very, very lucrative, and you can get something from like $50 an hour, and you also get then your living out allowance, which is about $105 a day, over and above your salary. You get that living out allowance if you work over 100 kilometers away, anything over 100 kilometers away. And then also your airfares are paid, and your meals, and it's quite a good lucrative option. The average salary in New Zealand for an enrolled nurse is anything between $60,000 and $75,000 a year. Whereas in New Zealand, it's quite a bit higher. You'd get from about $64,650 a year, which is about $33 an hour. The more experienced EN can go up to like $83,600, and that's not with agency, that's just ordinary. Obviously with agency you will get more, but just remember that the more you earn, the more you are taxed. So let's just say you have a second job. Your second job, you can pay up to 1/3 of that salary on tax. So it's probably better just to work for one particular place. I hope you guys have enjoyed this video, and I really just would love you to comment below if you have any questions, and I look forward to giving you more information, and I look forward to seeing you in the next video. Please like and subscribe to my channel. Thank you. Bye.